my name's Lisa. I'm here to chair this today. I'm just going to try and keep things to time and make sure that everybody has the opportunity to speak and to share their opinions. It is a very important subject. We're talking about drug and alcohol use in the LGBTQI community, and we've got some really excellent speakers here today. So without further ado, I wonder if I could go around and you could just introduce yourselves a little bit and explain why you're here today. So if I start with Adam.
Okay, thank you, Lisa, and thank you, Pride Cymru. My name's Adam. I'm a 38-year-old gay man from Newport, and I wanted to be involved with this due to my past being a drug user for many years, and I'm pleased to celebrate in September. It's my 10th year of being drug-free.
Brilliant, brilliant. Stephen?
Thanks, Lisa. Hi, well, I'm Stephen. I work for Terence Higgins Trust. I work in Lanarkshire in Scotland, but this is a topic that I deal with all the time. It's slowly getting something that's bigger over time. More people are talking about it, more people are wanting to know about it and how to support. So I was a bit of a late addition, but I'm really happy to be here and talk about it as much as I can.
Cool, lovely. And Juan?
Hi, yeah, thank you, Lisa, and thank you to Pride Cymru for organising this really important conversation. I'm Juan Fernando Ochoa. I work for the International Drug Policy Consortium, which is a network of 191 organisations from all over the world, 75 countries, that get together to repair the harms of punitive drug policies and try to build fairer alternatives instead. So that's basically what I do.
Brilliant, brilliant. Well, I'd like to start, if I could, with getting a background on the issues. I mean, I know a little bit about what's happening locally in Wales, but my knowledge is very small. I work with children and young people. I work around the preventative ends of sort of drug use. So I'm really interested to hear from your perspectives what the current issues are, what the things are you're seeing, what the situation is like out there. So I wonder if it might be worth going around you again and again. So if I start with Adam, is that okay? You're on mute.
Thank you, sorry. So for me, from a personal perspective, the drugs are so easy to get hold of, and they're so commonly used now, and it's so well promoted, not in a bad way or good way, but on dating apps and hookup apps like Grindr, etc., where people are advertising now 420 friendly meetups, chemsex meetups. So it's so prevalent in your face now that there does need to be more awareness and education and support put out there to prevent it. As I mentioned in my introduction, I'm coming up to my 10-year anniversary of being drug-free. I still feel the after effects of it now. I still suffer a bit with paranoia and stuff like that. So I'm one of the lucky ones. There's many that are still on there or have lost their lives because of the drugs. So we must do more, and this is why I really want to get involved with whatever we can get from this.
Cool, that's brilliant. Thank you, Adam. Stephen?
I think the issue is it's part of the culture when you go to the scene. The hypersexualization and the drug and alcohol use is just part of the culture, and one of the kind of things that comes up with that is we're dealing with people who may have been in the closet, and then they're eventually becoming who they want to be. So it's a kind of issue of telling people who've had to repress themselves, or you've got to be a bit responsible. And so that's been an issue of how to engage with that, how to get that message across without alienating anyone.
Yeah.
Can I just come on with what Stephen just said a minute about people being in the closet and then coming out, is the issues they face personally, and it's like they've been in the closet, their mental states, their mental health and well-being is one of the reasons I went on to drugs. It was a coping mechanism, and hence why it does need to be a lot more work done and support available for LGBT plus individuals.
Absolutely. And Juan, what, from your perspective, what are you seeing? What's the situation?
I think there's already so many. I've been writing down what Stephen and Adam have mentioned, because there's already so much in what they have said that merits a different, like a separate conversation. So many strands. There's clearly an issue. We know because of the numbers that we have just received or have been just released from both Scotland and England and Wales. I think it was last week. That this country has the worst record of overdose deaths in the EU. In the case of Scotland, is one of the worst in the world. And so we are losing a lot of people to completely preventable deaths. And each story, each individual has a family, a neighborhood, a community. So like, I think we always need to have this in mind. And we need to think of what is failing. And for me, something that is very clear that has failed over the past 5 years is that government after government has refused to invest significantly in integrated services of quality, of great range, to account for the different experiences that people may have with drugs. Some people, and this is a parenthesis that I wanted to make, according to the numbers that we have internationally, only 20 or about 20% of people who use drugs will experience challenges with said drugs. But that's for those 20%, there should be very well accessible, very well funded services that they can very easily benefit from. And that is not the case in this country. There is a dearth in funding. As I said, over the past 5 years, we have seen cuts by over 160 million pounds. Recently, there was a report by Dame Carol Black, who sounded the alarm on this issue and urged the government not only to invest in health services, but also in housing, in support for work. So there's so much that can be done. And I think what's infuriating is how little is being done. And this is on the general level. And then when you look specifically at the needs of queer and trans communities, the situation is, and LGBTQ plus people in general, like the situation is even worse, because services very often will, misgender you, will be completely unaware of the circumstances of LGBTQ plus people in the country. And everything is designed with a heteronormative and cisnormative lens. So for our community, we sort of are bearing the burden of multiple intersecting failing systems of support and care. And instead what we have is systems of punishment and criminalization that are working like a well-oiled machine. And every year there's dozens of thousands of people who are stopped and arrested, but we're not seeing the other part of the story, which is the cost that goes into maintaining those systems of punishment and criminalization are being siphoned away from care and health services. So yeah, we need a wholesale, careful, profound rethink of the way we approach drugs in this country.
Absolutely. So what do you think of, so just this morning, William Hague, a former minister, has said that the decriminalisation of drugs is needed, that the war on drugs just isn't working. And there are more voices all the time, aren't there, sort of adding to that argument. So is that something that you're all in agreement with then? So decriminalising, so making the users of drugs not the criminal, but they need support rather than a criminal record or to go down that sort of route. What are your feelings on that? What do you think, guys?
As long as they haven't committed a crime, no criminal offence should be made. As a ex-user, it was support that I needed. It was support and encouragement that got me off drugs. I'm lucky I had a job, so to cover the cost of my drugs, I don't have a criminal record or anything like that. But I know in the line of work that I'm now involved with, had I had a criminal record, the odds on me being in this line of work would be very slim. So it isn't, and you've got to take it by an individual person's case on case. A lot of drug users, there's reasons for them to get into drugs, and we got to be looking at the start of their drug journey to then try and prevent them and put measures in place to get them off it. When they come off, they don't want a criminal record because they're going to struggle in everyday life, and they're just going to think, sod it, I'm going back onto drugs. It's an easier life. And so the system does need to change, and it does need to improve. Do we have a government that is willing to do it? I don't think we do. I think we've got a government at the moment, even developed nations, that don't understand, and for whatever reason, so perhaps they need to come out onto the streets and start actually engaging with reality rather than political life, if that makes sense.
What do you think, Stephen? Have you got an opinion?
I think decriminalisation is a starting point in terms of chemsex for gay and LGBT, the queer scene really. People are getting it. There's no much stigma for it. People will go and take drugs and be very open about it. In my experience with the clients that I deal with, and even my own personal experience in the gay scene, it's like, just make sure the bouncers don't catch you because we'll get kicked out. No one's really thinking about the police. No one's really thinking about the criminal record. And even my dealings with the police through work, they're not too bothered about catching the people that are taking drugs. They're more interested in the dealers. And it was quite surprising when I was doing chemsex training with the police. They were really interested in the quality of the drugs rather than people actually taking them. They wanted to make sure that if there was drugs that were like dodgy, or I don't know, there was people that were getting sick with them, they wanted to let people know about that, which I found really interesting. And that kind of came back to what I thought about decriminalisation. And decriminalisation, as Adam mentioned, is a very political thing. It's very political. It's a very hot topic, hot button thing that people will talk about. But in terms of it actually, in my experience on the scene, people are buying drugs like on Grindr, on Scruff. No one's really caring about asking for coke, asking for Tina, asking for ecstasy. They're just doing it. People are getting Ubers to their house with drugs being delivered. They don't care that their taxi driver knows. So in terms of the decriminalisation aspect, is a very political thing, which I don't think helps the support. It doesn't really help where it's needed in terms of support for the people that are using drugs within the scene.
Well, that's really interesting. Do you think it might help with the quality of drugs and safety there? I know that what we see I mean, obviously I only work with young people, but what we see is we've seen an increase in sort of death rates from MDMA use and things like that because of strength and because of well, we've seen it now with Xanax and things and benzos. Mm-hmm. So do you think that it would help with the quality of drugs, or what do you think about testing drugs?
In terms of quality of drugs, decriminalisation wouldn't help, in my opinion, because it's just decriminalising it. it would need to be some sort of control mechanism or a pharmaceutical grade of drugs. So pharmacies would need to look into drugs of given a specific amount of cocaine or heroin or ecstasy, because there's a regulator involved. Decriminalisation doesn't really talk about if a regulator is going to be involved or not. It just talks about decriminalising the drug taking. So it's something that I think is a step along the way of helping, but it's not the end point, and especially with the quality of drugs.
So I don't know if in Wales we've got Weddinos. I don't know if you're aware of Weddinos. So Weddinos is a testing centre, and it's quite new. It's quite unique. So what do you guys think about testing, Adam and Juan, about testing of drugs? I know that they've started doing it in festivals and things like that. Do you think that would help at all from the health consequences?
I think, and if I may, just to talk a little bit about criminalization and decriminalization, I think I definitely echo Stephen's point about it not being an endpoint. But of course, it is really hard to engage with a population supposedly from the prism of health when you are liable in the books to being criminalized. And I completely hear what Stephen said about, yes, it is not incredibly common for especially white gay men to be approached by the police in relation to the criminalization of drugs. But we know that in the past 10 years, there have been a million stop and searches and arrests in relation to drugs in this country. And very often it is targeting drug users, and very often it is targeting drug users who are people of color and Black. So I think we need to be a bit mindful of what segments of our communities are being targeted by policing and which segments of our communities enjoy a certain degree of latitude where policing doesn't become as much of an issue. And always have this in mind to mobilize in solidarity with other populations who are targeted by policing. I think decriminalization is absolutely, for me, it's a baseline. You cannot approach this from a health perspective if you at the same time are threatening people with the likelihood of being criminalized. So for me, it's a matter of, as a drug user also, for me, it's a matter of self-respect to demand that I am approached as an individual and not as an evil person, quote unquote. And there are more than 30 countries around the world who have implemented this, including Portugal, for example. So in Portugal, this is something that the government decided to do in 2001. They had a huge issue with heroin, and people, as in that issue was about people dying in relation to their use of heroin. And they thought, what can we do? And they sort of had this two-pronged approach. On one hand, ending the criminalization of people who use drugs or people in possession of small amounts of drugs, so that people wouldn't be scared of engaging with services across the board. And on the other hand, really ramp up the provision of services, including drug checking services, including safer consumption sites, including heroin assisted treatment. So whole host, again, of services in a context of decriminalization. And this is not just the position of these 30 countries. In October of 2018, the UN as a whole, the UN system as a whole agreed to promote decriminalization as a means to promote an enabling environment for people to access health services. So I think it is a baseline, and there's then so much that we can build on top of that, including drug checking services, which of course would, if they were easily accessible, because I think Weddinos at the moment is mostly postal, if I'm not wrong.
It is, yeah.
If it were easily accessible, if it's something that you could, like on your way to the club, on your way to a chemsex party, make sure that what you're taking is not tainted with substances that you're not expecting. that doesn't mean that it's going to end the health challenges associated to drug use and drug taking, but it will certainly reduce the potential harms. And that is the paradigm that I think I am the most trusting of, this idea of harm reduction, where we can exist and our decisions are respected as drug users and non-drug users alike, but that we have the tools to make decisions about our bodies and about our lives, reducing the potential harms that might be associated to those experiences and those behaviors.
Absolutely. So picking up on what you said about reducing harms, I'm just wondering what other things we could do to reduce harms. What does everyone else think? Adam, have you got any ideas? What would reduce the harms that are caused?
I'm not sure, but reducing the harm but also looking to try and reduce the number of people that actually want to go onto drugs. We as a society could be doing a bit more around accepting and inclusion. And by us being a more open and accepting society, it will mean less people are going to go and try and take some drugs to escape from reality that they fear and they hate. So it is
so stigma yeah. is a big thing. Absolutely. And you've mentioned as well, you mentioned earlier education, Adam. Yeah. Do you think that's something that's needed?
Yes, there was growing up in school, there was nothing taught around drugs. There was nothing taught to me about alcohol or substance misuse. There was nothing taught around different sexualities in school. Yes, now we got change coming within within education, but we've still missed a generation or two out of what is reality of life. And so I just hope and pray that governments can do something to tackle the generations that are missed, so less lives are being lost.
Absolutely, thanks, Adam. Stephen, have you got any sort of opinions or experiences about the stigma in particular around sort of drug use, and as well as that, if I can add, what do you think, is it just stigma that stops people seeking help, or do you think there's more at play?
I think just to say to agree with what Adam said about educating people is like the thing that I'll do. I'll go to schools, colleges, workplaces, anywhere to kind of talk about this stuff. And more the past year, there's a lot of referrals about chemsex for frontline staff workers, because people are coming forward with these symptoms or these situations and nobody knows how to kind of deal with them. They don't know the kind of jargon that goes along with it.
That's interesting. Can I stop you there? So are you saying that when they come into contact with sort of health services, the health services don't know?
Yeah, health services are like, what is happening with this? Like they'll say, oh, I've been slamming at the weekend. What's slamming? And it's like there's that little bit of information that doctors and nurses and it's we're looking at it through a kind of minority lens, like, so the LGBT queer community is a minority. So in terms of how the doctors and nurses get trained, it's always going to be for the majority, which is mostly generally for straight people. And so that's something to kind of be I'm mindful of when I'm training people, just to give them a little bit more understanding, a little kind of a bit bigger understanding of vocabulary when it comes in. But training and educating is something that's like, in what Juan was saying about from a harm reduction point of view, it's I think the most important thing to kind of talk about. And as well, is to actually to let and I'm just going to talk about gay men for instance, because this is who I predominantly deal with, is to tell them that taking drugs can lead to unhealthy outcomes. Because that's like, sometimes I'm dealing with people and their expression is like, yeah, but that won't happen to me, or there's all right, okay, well, what do you mean by unhealthy outcomes, or what do you mean that something, it's so ingrained within the culture, the scene, that you go out and you enjoy yourself and you do what you want, and finally you can be who you want to be. That it's that is something is an issue for some people to kind of be able to go over that, and that actually I need to be a little, maybe think about being responsible with my drug taking. It's not, and it's always a question about balancing it and getting people to look at it from a different view, which can be quite tricky sometimes.
So what advice would you give them? I mean, as regards, would it be around sort of safer sex? Would it be around PrEP? What, you know?
I'm like, when I speak to groups about chemsex, it's just to be mindful. That's all. Like, be mindful of what you're doing. That's the like, because I can't control the situation. I always let people know that I'm not here to tell anyone what to do. Like, I'm not here to tell you what's right or what's wrong. It's just to be mindful of the situation. When you feel a bit like you've taken too much, like, have a time out, just chill out, go to another room, have a drink of water, like tell like some of your friends where you're going, like, because sometimes chemsex parties can last for days, so it's to let people know. It's kind of like, just from it's getting people to kind of think about the situation before they go into it, where they can be a bit mindful on how they can protect themselves, because when people are taking drugs, up to the point of taking drugs you can be responsible, but after that it's a bit more difficult, so it's a bit, people understand it.
Adam?
Just to follow on about what Stephen says and the advice he gives, one of the things I used to do was I tell people, if you're going to go and take part in chemsex or you're going to take drugs, be mindful about who and where you're getting your drugs from. Don't just get it off Joe Blogs off the street or in a club that have just know that person, and at least then you've got some sort of trust of, I've had drugs from this person before, I know they're okay, so I should be all right if I take it again. Don't just go and buy your stuff from random people, because that's 9 times out of 10, that's where you're going to face challenges and issues with the drugs. That's my thought on it anyway.
And it sounds a little bit like even that has got a big element of risk, because because you've got drugs from this person before and it's been okay, doesn't mean that it'll be okay next time, does it?
There's still risks, and it's like that person you bought it from, you don't know who they've bought it from and where they've bought it from. You still don't know, like, if you're having cocaine or whatever, what it's been cut with. So there's still risks, and a risk to anything when you're taking drugs. But just be mindful, we cannot tell people do it or don't do it, because you're just going to go and do it anyway. And if we're telling people don't do it, they're going to do it even more. But think about the consequences, what could happen, and how your family or friends may feel.
Absolutely. Juan, have you got anything to say there?
Yeah, I was thinking of, like, in terms of the challenges of not knowing what you have. I think that is something that we can definitely do something about it. And the reason why we haven't is because of an ideological stance from the part of governments, after governments, on them being wedded to prohibition. As we mentioned before, in a decriminalized environment, we could have drug checking be very available to people. So that could be an avenue. But in certain parts of the world, including in Vancouver, Canada, for example, drug user movements are organizing to demand the government for a safe supply. We as drug users should be able to access a supply of drugs of predictable content, stable, predictable content, so that we don't have to rely on back alley transactions that we don't know what they entail. And there is, of course, the risk of the substances, but there is also a risk in meeting a complete stranger who might extort you, who might, especially if you don't have the funds that are expected, who might inflict violence upon you to rob you of your money. So there's all kinds of things that we could be doing. And what our colleagues in Vancouver are asking the government to do is why don't you provide these substances to us, and we as a community distribute them in small groups, for example. And this is just one of the ideas that they are coming up with, but we definitely need to think creatively, because the status quo, what we're doing at the moment, is definitely not working. And I think the solution goes, a key aspect of the solution is empowering people to make informed choices about their health and their well-being. And I think Stephen and Adam were speaking very eloquently about that. So I definitely echo those comments.
Cool. So just to summarize so far, you've all spoken a lot about the situations why people from the community might use drugs. You've spoken about the stigma, we've touched on harm reduction, decriminalisation. So what, in an ideal world then, and I know Juan has kind of touched on this already, in an ideal world, what would it look like? What would it look like? What would we want? Who wants to go first? Go on then, Stephen.
I think more what Juan was saying about there's some sort of guidelines, government guidelines or regulatory guidelines when it comes to the making of drugs, like, because prohibition, always makes me laugh when I think about prohibition, because when it happened in the States, like, people were making gin in their bath and people were dying and stuff, and just to get a tipple at the weekends. It's something it just doesn't seem to work. Decriminalisation might be just like a starting point, but it's a really important point of opening up the avenues of, well, what kind of mad things can we think about that's never been done before? And I have always sort of like methadone patients will go to the pharmacy because the methadone is regulated. It's a controlled substance, but it's pure. It's not full of rubbish. And if you're, I don't know, I'm just imagining you could go to the pharmacy and get your bag or whatever it is that you wanted, but it would be controlled. It would be pure, because and that might sound crazy, but then you go to your shop and you get alcohol, which you know is pure. You know it's pure. You don't need to bat an eyelid when whatever bottle you pick. It's, you know, you're going to get whatever you
know what's there, that you read the label, you know what it is. And I think you've got a really good point there from a health perspective, that if that was and I'm just thinking out of the box here, you know, you could give clean needles if injecting was an issue. You could give clean needles. It would be an opportunity for some harm reduction, to give out some condoms. So you know, so you could even engage with some PrEP. Also naloxone could be given then if somebody is using heroin. There's so many things, isn't there, that if we just changed our thinking. Sorry, I interrupted. Carry on.
I think what you're saying is really important to kind of, it's about thinking outside the box when if decriminalisation does happen, and I hope it does. It's about thinking in a different way of how can we tackle this. But along with that, it's about making sure that the support is there at the same time, because it's not about going to the shop and just getting your couple of grams of coke or something and then away you go, because it's an addictive substance. You can't kind of go, oh well, okay, let's on you go. So it's about getting the right services involved, and especially when speaking about the queer community, about tackling internalized homophobia. That's something that I'll bring up about how to tackle chemsex use, of why people are going into using it. A lot of the clients that I'll deal with is about, like, they're bringing their homophobic family into the bedroom. How are they going to get over that? How do they get over that? So they'll take drugs and the drugs work and they have the sex that they've always wanted to have. So it's like about how to along with the decriminalisation, going to the shop and getting your MDMA, but having the right support along with that as well.
Absolutely. Adam, what do you think?
Totally agree with Stephen around the decriminalisation. But what it does do as well, it means, like, the police service, Crown Prosecution Service, it frees up their time so they can deal with other sort of criminal activities, and it can benefit society as well. I'm not saying drug use is the way forward to benefit society, but it does. I know for myself, when I was on the drugs, if I knew where to go without being felt like being frowned upon for the support, I would have got it much sooner. Twice I overdosed and ended up in hospital. So it's the cost that went on to the NHS and for like an out for me. And I finally got my support from education, which actually changed my life.
Do you mind me asking, what, if it's not too personal, what helped you?
I got into education. I signed up to a course in college, and I got introduced to the student union, and I was told I could be the LGBT equalities officer and go around all of Coleg Gwent and support LGBT plus students. However, one of the staff who was there told me, because I had to tell them about my addiction, they said I would have to I'd be pulled in for a test within 3 months, and if I failed that test, I'd be kicked out of college. Though it wasn't true, it was the kick I needed. Hang on a minute, I've just had a couple of weeks taster of college life, student union life. I don't want to lose that, and I just stopped there and then.
So just to paraphrase, it sounds to me like somebody believed in you and somebody gave you an opportunity.
And that's what it is. And that was September 2011, and September 2021 is my 10-year anniversary.
Congratulations.
One person believed in me, and now look where I am now. I'm alive, I'm talking to you folks, and I'm out empowering and educating and supporting minority groups.
You certainly are, Adam. Thank you. Juan, do you want to say something?
Yeah, I wanted to just echo what Stephen was saying about internalized homophobia, because I totally hear that, and I think it's important. We also need to, and I think we have all sort of alluded to this, like how we also need to combat homophobia and queerphobia and transphobia in medical institutions and in general in institutions. Like when I talked earlier about heteronormative and cisnormative institutions, that's exactly what Stephen was saying. When you go and talk about slamming and they don't know what you're talking about, or when in one occasion, for example, when I was younger, I asked for support, and I remember my doctor, my HIV doctor actually, when I mentioned, she asked me if I did drugs, and I said yes, and her response was don't. And of course, that's not conducive to you continuing that conversation. So we need to understand the realities of queer and trans people and make sure that institutions are prepared to have conversations that, yes, are difficult, yes, are complex, but that's where communities can mobilize to inform institutions about how to do that, and THD does it beautifully. I also wanted to underscore the importance of tackling broader structures of oppression that harm LGBTQ plus people in particular. So for example, poverty. We know that among young people who are homeless, a quarter of them are LGBTQ plus people. So, and contrary to popular belief, the majority, like there is the economic well-being, how do I express this? The socioeconomic status of, on average, of LGBTQ plus people is actually inferior to the general population. So we still struggle with poverty, we still struggle with homelessness, we still struggle with difficult, like challenging obstacles to access services. There's a lot that can be done to improve the lives of people who use drugs and who are LGBT, and in general, people who are LGBTQ plus, whether they use or not, that speak to, poverty, racism, neurodivergence. We have been talking about mental health and how it is important to ensure that those experiences are addressed. Many of us lived with completely unaddressed trauma, and mental health services are not really up to par. So there could be there could be so much done. And something that I realized also in preparing for this panel was how limited the research is too, that we need to do a little bit more research about the experiences of people who use drugs, who are in the LGBTQ plus community, even of economic outcomes among LGBTQ plus people. It was surprising how little there is. So there's a lot of effort that has to go also in data collection, disaggregated data collection, to know what are the challenges that we're experiencing. And I know when it comes to ChemSlex, we have done as a community great work, sometimes with the leadership of services that are by and for LGBTQ plus people, like Dean Street, like PhD, but there's so much more that can be done.
Absolutely. Well, I want to round off really by firstly asking you then what you all think of the Welsh Equalities Plan, because it does actually ask for more data collection, for more research to be done. It asks to address the cis heteronormative sort of language and treatment that people get sometimes from healthcare. It kind of addresses a lot of what we've said in maybe an indirect way. So I just wanted to ask just briefly what you all thought of it, if you were aware of it. And then I wondered if we could go on to what particular help there is out there and services available. So does anyone want to comment on the action plan first, those of you that know about it? Adam, you can't get away with it, you're Welsh.
I'm from Wales, I can't. I think the action plan is a much needed document for Wales. And I believe that the Welsh government is trying to make headway, especially around LGBTQI plus within Wales, and the people that they had on board as their advisors. I know some of them quite close as well, so I know it was quite good. It is a positive step, but my worry is that they may drag their feet in trying to implement, and the longer it takes for anything to come from this action plan, more lives are going to be affected. So I do welcome it. I just want to welcome it at a quicker pace than what we've seen it of late, if that makes sense.
That makes sense. Do you other guys know about the action plan? It's out for consultation now. Have a little look on Welsh Government, but it's really it's just, I only mention it because it does cover a lot of what we have just